This medicine is used for treating or preventing eye infections. It contains two drugs, Tobramycin and Dexamethasone. Tobramycin stops the growth of bacteria, while dexamethasone reduces swelling. It only treats or prevents bacterial eye infections and won't work for other types of eye infections. Using it unnecessarily or too much can make it less effective. It's important to follow the dosage instructions and take it at the recommended times for best results. When using Tobradex suspension, drops, it's important to follow the proper application technique. First, wash your hands to prevent contamination. Do not let the dropper tip touch your eye or any other surface. Shake the bottle well before each use. If you wear contact lenses, avoid using them while using this medication. Sterilize your contact lenses according to the manufacturer's directions and consult your doctor before using them again. To apply the drops, tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Hold the dropper directly over your eye and place one drop into the pouch. Close your eyes for 1 to 2 minutes and apply gentle pressure at the corner of your eye. Avoid blinking or rubbing your eye. If directed, repeat these steps for your other eye. Do not rinse the dropper and replace the cap after each use. If you are using other eye medications, wait at least 5 to 10 minutes before applying Tobradex. Use this medication regularly at the same times each day to get the most benefit from it. Even if your symptoms improve, continue using the medication for the full prescribed time to prevent the infection from returning. If your condition persists or worsens, consult your doctor. Some common side effects of using Tobradex suspension, drops may include blurred vision, eye redness, discomfort, and eyelid itching/swelling. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist. It's important to note that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects. Using this medication for extended periods may increase the risk of developing a new fungal eye infection and other eye problems such as glaucoma and cataracts. It's essential to use the medication only for the prescribed duration. Contact your doctor immediately if you notice any new or worsening eye symptoms, changes in vision, or eye pain. While rare, a severe allergic reaction to this drug may occur. Seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you notice any other effects not mentioned here, it's advisable to consult your doctor or pharmacist. Before using Tobradex suspension, drops, make sure to inform your doctor or pharmacist if you are allergic to tobramycin, dexamethasone, or other aminoglycoside antibiotics. Also, let them know about any other allergies you may have. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Before using this medication, inform your doctor or pharmacist about your medical history, especially if you have other eye problems such as glaucoma. After applying this medication, your vision may become temporarily blurred or unstable. It's important to avoid driving, using machinery, or doing any activities that require clear vision until you can do so safely. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is not known if this medication passes into breast milk, so make sure to consult your doctor before breastfeeding. It's important to be aware that Tobradex suspension, drops may interact with other medications, which could affect how they work or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without consulting your doctor first. If this medication is accidentally ingested, it can be harmful. In case of an overdose with serious symptoms such as fainting or difficulty breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. Residents in the U.S. can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. As for the uses of Tobradex suspension, drops, final dose form, it is commonly prescribed to treat bacterial infections of the eye and surrounding tissues. The dosage and frequency of use will be determined by your healthcare provider, and it's important to follow their instructions carefully. Typically, the recommended dosage is 1 to 2 drops in the affected eyes every 4 to 6 hours. It's also important to wash your hands before and after using the medication, and to avoid touching the tip of the dropper to prevent contamination. It's best to use Tobradex at evenly spaced intervals, and try to use it at the same times each day. It's important not to share this medication with others. This medication has been prescribed specifically for your current condition, so be sure to throw away any unused medication after your treatment is completed. Do not use it later for another infection unless your doctor specifically tells you to. If you are using this medication for more than 10 days, it's important to have lab and/or medical tests, such as eye exams, while you are using this medication. Be sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at the usual time. Don't take a double dose to make up for the missed one. When storing Tobradex suspension, drops, be sure to keep the bottle upright at room temperature, away from light. Some brands may also be stored in the refrigerator, so check the product package for specific instructions. If you have any questions about how to store your product, don't hesitate to ask your pharmacist. It's important to keep all medications away from children and pets. When it comes to discarding this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard Tobradex suspension, drops when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of this medication. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.